I take a lot of painkillers. My whole body hurts. I have pain in all my joints and all my bones. My doctor don't prescribe me opioids anymore. That son of a bitch. And they tell me I have fibromyalgia. Now what the hell is fibromyalgia? How we diagnose it and how can we treat it? Hello my friend and welcome back to Chatterdocs. I'm Dr. Tor and I'm an internal medicine physician. In this channel, I believe that learning about health and medicine does not have to be boring. So if you're new here my friend, don't forget to subscribe and turn on a notification so you'll never miss anything. What is fibromyalgia? It's a syndrome of widespread musculoskeletal pain in all your body, accompanied by sleep disorders, memory issues, mood disorder, and maybe chronic fatigue. Now, what are the symptoms of fibromyalgia? The primary symptom is widespread pain all over the patient's body, on the right and left side or above and below the waist, and it's been going on for at least 3 months. The second main symptom is fatigue, meaning that the patient is never well rested and refreshed. Maybe I have fibromyalgia. They sleep long periods of the time, but their sleep is usually disrupted by multiple awakenings and pain problems. The third main symptom of this condition is cognitive difficulties. This is commonly referred to as fibrofog, meaning that the patient would lose the ability to concentrate and focus on mental tasks and pay attention to a subject. Seriously, maybe I do have fibromyalgia. Fibromyalgia oftentimes coexists with other medical conditions such as chronic fatigue syndrome. It's another medical condition that the patient is always tired. Maybe I have this syndrome. Basically, I think some lazy-ass physicians who always wanted to lie around on a couch and watch Netflix made up this disorder to justify his laziness. Irritable bowel syndrome, which is a condition of intermittent diarrhea and constipation and periodic abdominal pain. Migraine or other headache disorders like tension headache. Anxiety, depression, or postural tachycardia syndrome. Now, what causes fibromyalgia? The exact mechanism behind fibromyalgia, like so many other medical conditions, it's still not fully known. Many believe that in fibromyalgia, repeated nerve stimulation causes changes in structures and also certain chemicals and neurotransmitters in these patients' brain and spinal cord. Some also believe that the pain receptors in these patients' brains develop a certain memory to the pain, so it's kind of always hyper-stimulated with painful and even non-painful stimuli. What are the risk factors of getting fibromyalgia? Number 1, sex. Not having sex, but your sex. If you're female, you have more tendency to get fibromyalgia than men. Number 2, family history. If it runs in your family, you may also get it. Number 3, other medical conditions. Patients with certain rheumatological disorders like osteoarthritis or degenerative joint disorder, rheumatoid arthritis, or lupus tend to be at more risk for developing fibromyalgia. Also, certain physical stress like surgeries, traumas can trigger this condition. And last but not the least, psychological stress can also have an important role in triggering fibromyalgia. But sometimes you can't even find a specific trigger. The symptoms accumulate over time and gradually develop fibromyalgia syndrome. How can we diagnose fibromyalgia? There's no specific test that could diagnose fibromyalgia. In the past, physicians would test 18 points of the body and firmly press it to see if they are tender or not. But the new guidelines don't include that, and the hallmark symptom of fibromyalgia is widespread pain throughout your body for at least 3 months. But your doctor may order some other blood tests to rule out other common medical conditions that can cause pain. They will check your complete blood count or CBC. They will send some rheumatologic tests like CCP, ANA to the B to the A. Also, they may send you for sleep study to rule out obstructive sleep apnea that can cause a lot of chronic sleep problems and chronic fatigue symptoms. Now, what are the complications of this disorder? The chronic pain, fatigue, poor quality of sleep can interfere with your daily life or with your job. Also, you could be frustrated because your condition is misunderstood by other people, even by your physician. They may label you as pain medication seeker, but you're always in pain. You're seeking some relief. So how can we treat this chronic, lingering, painful, annoying son of a condition. There's no one medication or therapy that could treat fibromyalgia. In general, the emphasis should be on improving patients' general health and self-care. Things like regular exercise, healthy nutrition, and regular good night's sleep is very important. Now, after this important step of lifestyle modification, there are medication and therapies that could help with this condition. The medication include number 1, painkillers. Regular over-the-counter painkillers like acetaminophen, which is Tylenol, or ibuprofen, which is also known as Motrin or Advil, or naproxen, also known as Aleve, could significantly help with the pain. Opioid medication like Percocet, oxycodone, OxyContin, morphine, hydrocodone, Vicodin, all the good stuff, are not really recommended because they can make you really dependent and they have a lot of side effects. So they have no place in treating fibromyalgia. Please stop bugging your physician to write some opioids for you. Number 2, antidepressants. Duloxetine or Cymbalta and milnacipran or Savella, amitriptyline or cyclobenzaprine, which is a muscle relaxant. Number 3, anti-seizures. Hard to believe, but some anti-seizure medication can really help. Medication like gabapentin or Neurontin can significantly help with the symptoms of pain and chronic fatigue. In addition to medication, there are therapies that can significantly help with reducing the symptoms of fibromyalgia. In physical therapy, your therapist will teach you exercises and stretches to increase your strength, overall well-being, and stamina. Also, water-based exercises can be very helpful. In occupational therapy, your therapist will teach you how to adjust your workplace and work tasks to cause less stress on your body and reduce symptoms of fibromyalgia. Also, counseling and psychotherapy or cognitive behavioral therapy can help you increase your mental abilities to deal with the stressful situation and the long-term mental effects of fibromyalgia. What lifestyle modifications and home remedies can you do? Number 1, stress management. Avoid overexerting yourself. Give yourself some time to relax. Learn how to say no to different tasks without guilt. But try not to change your whole routine all of a sudden, because people who lay off completely from work or change their daily routine to doing nothing will tend to do worse than other people who keep working. Try stress reduction techniques like deep breathing, meditation, or mindfulness exercises. Number 2, sleep hygiene. As I said before, because fatigue is a hallmark symptom of fibromyalgia, having good quality sleep is very essential in treating this syndrome. You should practice good sleep habits like going to bed at the same time and waking up at the same time every day. Also, limit daytime napping. Number 3, regular exercise. At first, starting to exercise may feel like increasing your pain. But if you keep doing that regularly, it's proven that it will decrease your pain and fibromyalgia symptoms. Exercises like biking, hiking, swimming are really recommended. Number 4, pace yourself. Fibromyalgia symptoms could come and go on certain days. You should keep your activity on an even level, meaning that do not overexert yourself on your good days and also do not limit yourself and do too little on your bad days. Number 5, maintain a healthy lifestyle. Again, eat healthy, do not smoke, and limit your caffeine intake. Find other enjoyable activities that can fulfill you. Is there any other enjoyable activities? Alternative and complementary medicine also have been practiced for thousands of years to reduce stress and pain. Number 1, acupuncture. It's not just sticking needles in your body for no reason. It's been practiced in Chinese medicine for thousands of years, and it's believed to change blood flow and neurotransmitters around certain parts of the body like spinal cord that has been shown to reduce stress, anxiety, and pain in fibromyalgia. Number 2, massage therapy. Oh, I love this one. Manipulation and moving your body's muscles not only increase your flexibility and range of motion, but also can decrease your heart rate, your stress level. It can relax your muscles and joints and also can increase production of your body's natural painkillers. Number 3, yoga and Tai Chi. In these practices, meditation, slow movement, deep breathing, and relaxation have been found to significantly help with fibromyalgia symptoms. As I said, fibromyalgia is a chronic disorder that needs a lot of attention from you as a patient and from your doctor as well. You need to work on improving a lot of aspects of your lifestyle and job alongside with the medication and other therapies. It's chronic, it's frustrating, and it seems hard to treat, but it's treatable. Thank you for watching. If you got any value, please don't forget to hit the like button down below. Also, if you have fibromyalgia yourself or you know someone with fibromyalgia, tell me down below in the comments section what therapies or medication or treatments have really helped them so we can help other people too. What was my sentence again? I shouldn't move too much. I should stay on this X. I should not do this. Please don't forget to subscribe right here and watch my other videos right here.